Welcome, everyone. This is not Dental Unfiltered. This is Clinical Unfiltered, the real reason you guys are listening to this podcast. We got a special guest today, Kricket Doker. Kricket, honestly, as much as I thought I knew you for the longest, I found out you were not indeed a dentist.
You're right, Sausha. You're very right. No, I'm a registered dental technician and a dental assistant.
You fooled the heck out of me. Because your knowledge of everything that I feel like dentists need to know is above and beyond. How did you get into that role and adopt all the dental knowledge you know?
Yeah, so I'm a super big nerd about dentistry. I really wanted to go into dentistry because I fell in love with my dental practice growing up. It was like a family. I love their work hours. Not that I have the best work hours. Let's be honest. I teach a lot and practice 4 days a week. But back then, I thought about work hours, and I got into it initially as a dental assistant, and I really loved it. But I got into a practice that focused on digital dentistry, and that's really where I kind of took off. So I wanted to, learn everything, every aspect that I could. And then I went on to get my technician license, and now I practice Monday through Thursday in a private practice in upstate South Carolina, and then I teach on the weekends occasionally for a couple different dental companies.
Yeah, so I will tell you guys. So I've seen her talk and lecture and teach. And I mean, the amount of knowledge and pearls and how she implements this in the practice and what we're about to talk about right now, I'm sure you probably already try to get sniped from your office all the time. I'm sure you're about to get DMs right now being like, how much are they paying you? How often do you get that out of curiosity? Do
Oh
people
my
hey,
goodness, Sasha, a lot.
a lot? Okay, yeah,
Yeah, I
good,
literally
good.
work for the best practitioner. He is amazing. We're
He's
best
gotta be
friends.
amazing.
Yes, he is. He's really amazing.
Gotcha. So, Cricket, so today's specific episode, we're going to be talking about digital dentures. And I'll tell you, digital dentures, like 3D printing, specifically 3D printing digital dentures, was almost the inception of how we created our implant hybrid offices that Dr. Vallo and Matt help out with, the hosts for the other podcast. I got so into 3D printing in residency, and I was like, man, I really hate removable. I hate doing wax room try-ins, wax teeth. I hated it so much I became a periodontist. I figured out all the other perio stuff after I got over my hate for dentures. I was like, screw it. I'm going to either give them implants or save their teeth periodontally. I'm not going to give them dentures. But when I got into 3D printing, I saw people 3D printing dentures, and that actually brought me back in a little bit. I was like, okay, wait, maybe there's a whole nother way of doing dentures that isn't messy and involving a million steps, and probably maybe puts a little bit more power into my tech hands. So 3D dentures, have you physically printed a 3D denture?
Yeah. So we do 3D dentures at my practice all the time. I think they're an amazing addition within the practice. Not that maybe every patient would get a 3D printed denture. So in our practice, it's not that every denture is 3D printed, but a lot of them are. So I do a ton of immediates. I do a ton of interim dentures. The benefit that I see with 3D printed dentures is it gives me more control, right? We like to keep everything within the practice if we can. So it gives me that control of getting it faster for the patient, so they don't have the turnaround time that they used to, as well as the fit. I mean, we're coming right from a scan for that prosthetic, so the fit is unreal. The suction, there's no air really in it. It's very minimal compared to a pore, and then when you inject the acrylic for the denture. So that's been incredible for me.
That's what I was trying to explain to people. It's when I first got into it, first noticed digital dentures popping up, and I was like, theoretically, when you're doing all this all these attempts
Yeah.
to capture dynamic movements,
Mm-hmm.
you're taking so many extra steps because your gooey impression material squishes tissue. It's
Yes.
not
Correct.
realistic. People aren't having impression material in their mouth 24/7, and that's what you're capturing and then giving to a technician to design a denture, and it's not realistic because that's just not how the tissues are settling when you shove impression material. Now you go through all those steps like border molding to try to recapture it, but an intraoral scan is essentially a static impression of the tissues tensed out. So whatever comes back has got to be more form fitting and less likely, right? That like muscles are going to pull
Yeah,
on and tongue
it's
on.
incredible. I mean,
So
it's
you've noticed
incredible.
better fits.
For sure better fits. And I honestly, I'm really nerdy. I said that. So I've been testing like a posterior palatal seal on a 3D printed, so with one and without. So all my patients that I've done it for, I've printed both. So I've printed one with and one without, just to see if that affected the suction of the prosthetic.
Mhm.
And from my findings so far, there has been no effect for more positive suction with a posterior palatal seal. If I really had to argue with you, I might would say they may have a little more retention without a posterior palatal seal because of the accuracy of the denture. It's not really needed.
Again, when you press the impression material and you're pressing
Correct.
against that like
Yeah.
soft
Soft
palate,
palate. And
you're
yep,
pushing into it.
you got it.
And then when you open or chew, like that muscle or that tissue mobilizes.
Yeah.
So if you put something extra into that tissue and then mobilize it again, boom, it could
Yeah.
fall out. So if it's something just sitting and you got that like good, that aqua seal going on, that should be enough. That's actually one of the like the things that I thought we need to revisit digital dentures is because the
Hmm.
fits might actually be better. Now, the other thing is everyone's like, okay, they don't look the best. That's another issue. And that's honestly why I didn't dive in is
Yeah.
because there's often when you're printing dentures, you got the white and the pink. And on the 3D printed hybrids, we're just painting
Hmm.
on top of a white base. Now I notice on dentures, it's like you almost want teeth and base. Is it still like that? Like you got
Yeah, so thank goodness the resins are improving so much. So I work with Sprint Ray personally. I'm a key expert for that company as well as a certified trainer for them. So I'm really using their printer and their materials. So I started with doing a lot of the high impact material that they had, but high impact is really opaque. It's not very aesthetic. So if I was going to do a monolithic denture for my patient, I would usually print that in Onyx or Onyx
oh,
Tough,
okay,
and
gotcha.
then I would characterize it with Annex gum. I don't do a ton of those. So the only reason why I would do those is say I needed something super fast and the patient brought me their denture, it's broken half. I would glue their denture back together, 360 scan it and print it with Onyx and characterize it. And I've got a picture of one that's pretty amazing.
Okay, gotcha.
But that's a lot of work with the tissue. What I prefer to use is Sprint Ray's new material, Apex, and I'll print the base and then I'll print the teeth. And this material is a lot more
Both
aesthetic
in
because
apex,
it
the
has
teeth and the base
correct,
are okay, gotcha.
right. And they're much more aesthetic because they have a little bit more translucency with them to look more like natural acrylic. Now, I will say this stuff is super hard. So, like the rigidity with it, it's much stronger than traditional acrylic. I think the downside is usually when we're printing our teeth in like one whole section, right? So aesthetically, the teeth don't look really individualized, and I think that's where a lot of the aesthetic concerns with a 3D printed denture come from. So there's things that I do. For instance, I use Empress Direct's material from Ivoclar and just do some characterization. So much like ceramics, I work a lot with ceramics and Mio. That's kind of on the resin side to make sure the teeth look more individual. That gives more of an aesthetic appearance.
Gotcha. And so you're doing a lot of the work I'm assuming you're doing the work on the actual teeth that come 3D printed.
Yeah, yeah,
And you're just
and
being, so they got a little bit of translucency with this Apex resin compared
correct.
to, because like I was doing the Onyx and I was like, man,
Yeah.
this is like opaque.
No,
I mean,
it's
it's
super
like,
opaque. Yes,
yeah, I
yes.
mean, the way I kind of communicate with my patients is like, especially if it's an immediate denture or like an immediate temp hybrid, I always tell them this is like I focus in on the healing component. I'm like, you got something that's designed to help your bone heal.
Yes,
Be
yes,
lucky it looks like teeth, but like it's in there designed to help you heal, especially hybrids. You don't want them
yes,
breaking. So I really emphasize you break your arm, you get a cast. That cast is designed to immobilize. Same thing with a temp hybrid. It's designed to mobilize the implant. So I emphasize that. So then when they get that super opaque, they're like, all right, this is a cast. It's nice, strong, but yeah, I mean, you get the patients who are barking about it and they're like, man, this is really, really white. And I mean, it's got no life to it. Really doesn't. So the Apex resin, how long have you been using the Apex resin? When did that like
for a
max?
couple months now. But
Okay.
it's much more aesthetic than high impact. So much more aesthetic, and I think the strength is more as well. But for me, the aesthetics are huge.
And that's coming from Sprint Ray. The
Yes.
resin itself. Gotcha.
Yeah.
So you're still occasionally playing with OnX to 3D print these
Yeah, so if I
occasionally.
3D print like a hybrid, it's going to
Yeah.
be Onyx usually, and I characterize it just because it's super dang strong. That stuff is like hard as a rock.
Right. No, no. If you ever print those and like cure it and then drop it, it's got that cling on like a small
Yes,
drop. Don't drop it like from way up here, but like you drop it
true.
right. I like to hear it cling on the table sometimes, like ding, ding, ding. But but you're saying you're occasionally still using it for an immediate denture.
Yeah, so if I have a patient, like I said, like that broke their denture in half and I need something like that day, then I would glue their denture back together, 360 scan it, and print it really quick so they can have their full denture and not have to worry about that big crack in it.
Gotcha.
I will say, though, think about like our lab. When our lab makes me a denture, I mean, it's taken like a month, Sasha. Like a
Right.
month. I mean, I have a try-in, I have all the, and I can get a 3D denture finished for a patient in 2 days. I mean, 2 days. That's insane. So I have a patient, and I have a picture. We don't have to show this, but the patient, bless her sweetheart, she has this immediate denture that my lab made for her, and she hated this denture. Okay, so she really never wore it. So she would put it in her lap when she would drive, and she pulled over on the interstate and she got out just in a hurry and forgot her denture was on her lap, and the denture like flew off, and so it got ran over on the interstate. Okay, so she broke this denture, and like I mean, like I'm not even kidding. Like she called me on a Saturday and was like, Cricket, I need your help. My denture is broken. I said, okay, save every piece and bring it to me Monday morning. And I was thinking maybe it was like broken in like 4 pieces. I could glue it together, 360 scan it, like I'm good.
Yeah. This is like she ran it over and then ran it over again, and then she looked at it and said, "Screw you, denture," and like
Yes.
the rocks people elbowed it.
Yes, it's terrible. But so what I did was I designed her a custom tray really quick. So I scanned her ridge, her maxilla, and
Okay.
then I designed her a custom tray and mesh mixer in like 2 minutes. Super easy. And then I
Gotcha.
3D printed that custom tray with model resin. And then I stacked some wax on it. I completed a records appointment, designed the 3D
The
denture.
wax to kind of create like a video on her
Correct.
in
Yep.
midline. Okay.
Video, midline, can, all that. I captured
Gotcha.
that. I washed that, of course, that custom tray, and I 360 scanned it. And then we did a 3D denture design. I printed it in model. So I like to print my try-ins in the absolute cheapest
Mhm.
resin known to man. Like, why in the world would I buy try-in resin? I don't want that. I want
Yeah.
like model resin. I want like cheap resin.
So we have a lot of surgical guide resin, which is a
Yeah,
little bit more than model resin, but we just
it
have
is
a
more.
lot of it.
Yeah, yeah,
But that's what I'll use. That's like my go-to default. Like, okay, I need a print, a quick try-in denture or a try-in hybrid, or
yeah.
like I just want to get the midline and the bite and like
Right.
maybe adjust it a pinch and then rescan to have it fabricated. I won't
Yeah,
reprint it in OnX.
yeah.
You
Same.
know,
Yeah, yeah.
you're going
Same.
even though it's not that much. We're talking like $10 difference per print, but that's still,
Yeah.
I mean, that adds up. You know, if you're doing like hundreds of prints a year, you're talking thousands of dollars. Yeah.
Yeah, so I had that try and printed by the end of the day. We tried it in, and Sasha, when I tell you, like this is like nailed. Like it's very rarely that I don't complete records and execute my try-in with a 3D denture. It's insane. So completed that. The records were great. The try-in was wonderful. I printed a split file too for her because I did one with a posterior palatal seal, one without.
Okay. Yeah.
Just so she had an extra one in case this happened again and
Uh-huh.
it didn't survive
Yeah.
the interstate, and then she had an extra. But and she had a new denture the next day. I mean that would have taken her a
Yeah.
month without teeth.
It sounds like it does take a little bit more time though to use the Apex because you are characterizing it more, or do you spend like,
I don't spend much time though, to be honest. So I'm
okay,
using Annex gum, like the syringe pinks,
okay,
like the dark red and the light pink, to give a little bit more, like, you know, ultimately tissue shouldn't look like monolithic in color. So if you like very quickly put a little bit of red and a little bit of light pink on there, it makes it look much more realistic. And then the teeth, I'm really candy coating the prosthetic as well. So with the denture resin, and then I put it in glycerin for final cure. It's kind of a long story. It's not a validated workflow that I can teach with Sprint Ray. I will
gotcha.
say that. I kind of get slapped on the wrist if I bring it up,
Well, no
but
one's
I
slapping
will
you
say
here,
that's
girl.
what I'm doing.
Do
I'm doing that. So I'm basically painting I'm covering. So I'm instead of having to polish it after the prosthetic's finished, I'm basically painting the resin on So before it's cured, and then I will put my Empress Direct colors into the resin, and then I will half cure the prosthetic, drop it in glycerin, and then full cure. And then when I pull it out, of course, it's nice and polished and beautiful. And all of those stains are kind of like more internal and not external, the where they can brush it
Gotcha.
away, if that makes
Gotcha.
sense.
Yeah. No. Okay. Good. That's a good way to like lock it in, the
Yes.
layers.
Yeah, yeah.
And so, I mean, you kind of just did us. I mean, essentially, the workflow you just told us seemed to be more related to like a patient who walks in with nothing. Like
Yeah,
that's essentially what he's.
I do a lot of that. I don't know. I guess
Yeah.
I'm doing a lot of that 3D because I know I can do it so much faster. And I
Yeah.
love a record. You know why I love a records appointment? It's because the wax room appointment is one of the harder things, and dentists hate that. They hate it. I mean, and you know
Two
what?
hands up in the air. I hate that
I
thing.
love it because it was challenging for a while, and then once I got it, I just so
So I've actually come across some individuals that have it's like a 3D printed, like if a patient has nothing and you still don't want to do a wax rim try-in, there is devices that you can
there
3D
are.
print that you can use that essential device to try it in and determine your VDO at midline. I'll tell you though, I've tried those and my personal, this is actually what brought me back to wax. This is the only moment I use wax. It's just quicker for me to
Yeah,
slap wax on it. And this is honestly, this is part of the reason I forget. And so for me to print faster, it's easier for me to print that base tray and
yeah,
put wax on it than to print the device because it's a little bit taller. So for
yeah,
me, I remember it's 8 o'clock in the morning and the patient's coming in at 9:30. That extra hour of printing time for me, it's like it's more important I just print the essentially the flat base that goes against the tissue, like a tray, and then put wax on it
Do
to
you do
mark
that
and then I'll
universal, or are you printing like a universal tray?
no, no, no.
Oh,
So
okay.
I always get like at the initial appointment some
The
scan.
ridge
Like
skin.
I'm like,
Gotcha.
my assistants know if the patient's coming in and have the intraoral scanner ready,
Yeah,
we're gonna scan something.
yeah.
Whether they got teeth, tissue, denture to scan, we're scanning something, some
Gotcha.
record that I can play with. At this
Okay.
point, like having a printer, I think opens up the ability to be able to play with it. And for me, having data or 3D files to then mess with is always useful. I might
Yeah.
not use it, but wasn't that hard to get. And
Yes.
so I always
Yeah.
like to be locked and loaded with ammo to be able to
Yeah.
handle these cases. I guess what I want to kind of go through is now I want to do like an immediate workflow. Like you got a patient with teeth. They're not going to do a hybrid. You're going to do extractions and then we're going to deliver a denture. Kind of walk me through your steps there.
Yeah. So I'll say this before I give you that workflow. If a patient comes in a dentulous, we've talked about that, and you know my process for that. Doing a
Yeah.
custom tray mesh mixer, stacking wax, 360 scanning. So if a patient has a
By the
denture,
way, Mesh Mixer, anyone who hasn't downloaded yet and has a 3D printer, you got to get it. It's like
yeah,
it's
you
like I
do.
call it like
You do.
Paint
Yeah.
for 3D files, like Paint,
And it's
like on
not that
Microsoft
hard,
Paint.
right,
Yeah,
Sasha? It's not that hard. It
it's
really
an
isn't, and
easy
it
software. Yeah,
allows you
they
to do so much.
it's not like honestly Exocad and all those other things. They're a
Oh,
little bit
great.
more
Yeah,
complicated
yeah.
and fine tuned. Like Mesh Mixer is like
And
add
it's
a
free. It's
yeah, you can
free.
add a bunny rabbit to your tooth, and it's easy. It's like a drag and drop thing. Like it's
Yeah,
it's really easy to use. It's free. That's another
yeah.
thing. It's free.
So, okay, so that's how I'll do that. And then a patient that brings in and they have a denture, for me as a practitioner, I don't care what the denture looks like and I don't care how it fits. That is the best custom tray that I can use because that gives me some sort of video to start with, some sort of midline. I don't care if the teeth's worn flat, I can still tell them to open the patient up. So if they bring to me a denture, then that denture is going to be their custom tray. I will not ridge scan and go through a records appointment with wax. That just is more time consuming, a little bit of extra stuff that I don't normally like to do. But if a patient comes in as an immediate patient and they need extractions in a denture, then I would proceed with a scan of the maxilla and the mandible, and then, of course, a bite. I would make sure that their video right now with where they're set at is good. I would make sure their midline is good reference. A big thing is photographs. Like you need full face pictures. Like how in the world can you get a designer to design you a denture without a full face photograph? And of course the patient has to have a good stop and they have to have good, like they can't be missing everything but maybe two teeth. Like in that case, I would still scan them and do a custom tray, right? And stack wax on it. But if they have a good bit of their dentition left, I would just verify video, midline, length, that kind of thing, and then just treat it as a traditional patient with upper lower scan, bite scan, and just do full face photographs.
Now, are you designing yourself or do you
No,
outsource
I
your
usually
design?
outsource to Sprint Ray just because I just have
Okay,
so many other things going on. But I mean, they're amazing. They get it back to me in 1 or 2 days, and like I
gotcha.
say, I mean, I really don't have an issue with it. And if I do, then I basically just request the change, and it's not a big deal. And it's really fast.
Yeah, no, I've used Road Dental Lab. Like I
Yeah,
said, they have like an hour or 2 hour turnaround. I remember I used Sprint Rate one time. They had a quick turnaround too. Just you had access to it. File turnaround with a smile again. I feel like is huge, and I feel like it's really something simple because they will use that data.
yeah,
And like
yeah,
with Road, they'll send me back like their exocad files. You can preview it in exocad and you can see the layer of where that facial scan or that like I have a facial scanner. Honestly, I don't even use it that much because
yeah.
sometimes a simple smile photo, like an exaggerated smile photo, so they
Uh
can
huh.
line up.
Uh
If they
huh.
got two centrals and you have the intraoral scan and they have that smile, they can line
They
everything
got
up based off
everything.
that. Right. So it's as simple as that. I mean, you'll get most of what you need from that scan. I feel like with those renderings they get, I mean, it's so darn close
Hmm.
to where things need to be. But even when it's off just by a pinch, normally I'm able to do like some modifications and rescan the bite and then send it back. And after one more modification, which is again all emailed files, it comes back pretty darn close to what I need. I feel like I need like one or two modifications, and I'm there. It's
Yeah,
rare. I'm not to the point where I'm getting it one and done every single time. Normally, it's for me, it's like one or two modifications. I
yeah.
don't do a lot. Like sometimes I'm lazy still with the wax trim, and what I'll do, like if they have like two centrals or something like that, I'm
Hmm.
like, hey, send me a try-in with teeth. Just like send me something what you got, and then I'll
Yeah,
try it in, and
yeah.
then based off that, scan their bite and be like, oh look, I'm so lazy sometimes I don't even whack down the bite. I'm like, look, you're they're 5 millimeter open because they're hitting in the posterior. I'll scan that bite and send it back to them, and then
And
they'll
tell them to close it.
be able to close it. Yeah, I'm that
Oh
lazy.
my
I'm
gosh.
that lazy. But
Okay.
remember, periodontist.
You get it done, so it's fine.
Yeah. So you outsource it, and you're 3D printing them day before the procedure, a week before, whenever you have free time, kind of thing, or
Yeah, just whenever the printer's available and I get the file back. I mean, my printer's running constantly with all the stuff we're printing, constantly running.
once you get them in the patient's mouth. How are these things doing after the fact?
So, knock on wood, I've not had one break at all. I make it clear that they don't need to drop them in denture solution. That's a contraindication for a lot of resins. Like, don't drop them in denture solution. So, they're just going to brush them. And I tell them the instruction of I don't care what they brush it with. As long as it's a toothbrush, they can use toothpaste. It can't be gritty. They can use
Okay.
Dawn dish detergent. Like, whatever you want to do, just make sure you brush them to keep them clean.
You tell them any specific bristles, like, oh, use like an aggressive brush. You don't
No,
use it,
I would
use like
tell
a
them to use soft, like they would use
soft.
for their
Yeah,
for their teeth, and then I would of course tell them that these are not acrylic, so they don't have to keep them in water for hydration, but
gotcha.
they have to
Okay.
brush them to clean
Yeah.
them. But
The beauty is, I mean, if it breaks, I mean, you're just printing another one.
yeah,
That's
yeah,
like
it's
is
so
the extra
easy.
beauty. You said you haven't had any break, so like can't even like testament to like having an Onyx version of it. But would you leave a patient with an on like what's why are you never gonna leave? Like it sounds like you're leaning towards Apex right now.
I am. I guess the thing is, it comes down to a traditional acrylic denture. It looks individual. The teeth look really individual, right? And these dentures you can reline. Like when you're getting a 3D printed denture, you can't permanently reline it, which really isn't that big a deal, right, Sasha? Because if the patient lost retention, all I would do would be wash the denture, 360 scan it, and print another one. Like it cost me no more than sending it to my lab for a reline to be done. So really, it isn't a big deal.
So wash it and have it sent to the lab technician to redesign it so that it fits the tissue a little bit better.
Correct.
Right.
Yeah,
Yeah.
yeah. So of course that's the negative is I can't do a hard reline per se predictably with a 3D printed denture. I would just wash the denture, 360 scan it, and have a new one designed and then of course refabricated. But I think more than anything is I still feel like acrylic is just prettier if we had to get down to the nitty gritty. You know what I mean? I feel
Okay.
like it's
Gotcha.
still a prettier, but now that could change really fast. I do like the Apex, but acrylic is just individually set teeth. It just
This is the thing that I've heard. Like, I mean, when you really think of it, it's like, oh, digital dentures don't look as good. I'm like, a lot of us who are printing them in office don't spend as much time. Like
Yeah,
you just described a process of going through and characterizing it that I don't think a lot of us spend.
yeah,
Who do 3D printed dentures. And so, like, when you look at people showing examples of 3D printed dentures, I don't think they look as aesthetic because there's not as much time put into it. But if you've ever seen an acrylic denture come out of a flask, it looks like crud.
it
You
looks
know,
terrible.
the
Yes,
technicians are,
yes,
nothing looks good fresh out the oven.
yes.
You have to put some icing on it and make it look pretty. So I think both of them have potential. Like there are 3D printed dentures nowadays that I've seen that do match the aesthetic quality that you want to get to. I think the overall hump is just honestly. I mean, what do you think? What do you think is the actual overall hump of a lot of people who don't do 3D printed dentures? But let's say they had a 3D printer.
Yeah.
Let's say they had one and an intraoral scanner. So now they got the parts and pieces. What's your limitation there?
Yeah, so I think I train a lot with Sprint Ray, of course, all
Yeah.
over the country, and my biggest thing is they don't understand the workflow. I feel like the workflow scares them, and they don't know what they don't know. Right? It's just implementing a new workflow and kind of knowing the process and procedures. Especially if they have to complete that records with that wax. I mean, that just tears them up,
I gotcha.
because
Yeah.
it's all in their hands to give it to the designer, and it could be a back and forth, where they're just. I think it's just the unknown, like how to lute the teeth together, how to
Okay. Yeah.
cure, how to polish, what system to use. Am I going to candy coat? Am I going to just polish? I think that's kind of a big thing, and like
Where do you go to learn it? Like where I like in 30 minutes we're not giving you those details. Honestly, probably in an hour we're not giving you those details. But where do you go? What's your like favorite source? What did you think is it a course you did?
Well, I would say there's a ton of free resources on Sprint Ray, ton of videos and stuff that of educational things on there. And I would say YouTube. Like I have a really good friend that does a ton of videos, Dr. Wally Renee, and he posts them on YouTube for people to
Oh
watch.
yeah.
And
Yeah.
he's amazing. I mean, amazing. Tons of free content. He runs the Mod Institute, and he offers courses, but his content on YouTube is amazing. So he's taught me a ton.
Yeah, no, that's a good resource. That's a good point. Yeah, so I mean, I highly recommend it. That's I think you're right. There's a like I've specifically heard people like how do you like this is the first question I get asked. How do you glue the teeth to the denture?
Yes,
I'm like,
they,
oh, okay, yeah. It's like okay,
yeah,
then we're gonna have to talk about processing it afterwards and
yeah,
polishing it, how to polish it, because there are some nuances there. But
yeah.
let's answer that question. How do you lute it together? Like
Okay.
that little component right here. So you printed you got the files. And a lot of times these labs will provide you with a teeth file and a denture base
Uh-huh.
file. So you can print them separately. You've
Mhm.
printed them separately, you've washed and cured, and you're ready to lute. What
Okay.
are you doing?
So, of course, if you're going to outsource this, the lab's going to provide you with a monolithic file, a teeth file, and a base file. So, just to review, the monolithic is going to be the denture. That's one piece. Okay, so it's all together. You would print it in basically tooth colored resin, and you could characterize the tissue. Preferably, if you're going to do a 3D printed denture for a patient that's going to be a permanent prosthetic or a long term prosthetic, you're going to want to print, as we call it, split file. Split file is where you have the teeth and the base. So you're going to print one first and then the other. And normally, a lot of times, you'll have the same resin. One's just going to be tooth colored and one is base colored. When they're done printing, you're going to wash the prints. For the prints or the resin that I'm using now, I can put it in my wash, and I'm not restricted with the amount of exposure time to alcohol, but you have to
Oh,
be
versus like
mindful of
on
that.
X or something
Correct.
like that.
On
Yeah.
X, you want to spray and wipe, and if you expose it too much, it's like really chalky and
Hmm.
white and looks terrible. But you can always rehydrate with and candy coats. Is not the end of the world, but it does look terrible initially if you do that. But this resin does not for me, so I'm going to go ahead and wash that resin really good and dry it. And then, of course, they're not cured, right? So we have uncured teeth, we have uncured base. So at that point, I'm going to either take base resin, so the pink resin, or tooth resin. It doesn't matter for me. It's the same resin.
Yeah, the same exact resin in that
Same exact
container.
resin. So
Yeah.
whether you want to fill it with pink or tooth colored, it doesn't matter. I have these little vials. I actually have one right here. You probably won't be able to see it, I
So prepared.
guess. I
So
won't grab it.
prepared.
So I have these little vials that I get on Amazon. They're amber color, so the light doesn't affect it. And
Okay.
I put a little bit of tooth resin in one, a little bit of base resin in the other.
Oh, nice.
And then
Yeah.
I'll just take up some of the resin and I'm going to just use my dropper. It has a dropper, and I'm just going to drop it into the tooth pockets on the base. And then I'm going to take a micro brush, make sure the entire tooth pocket is covered with the resin. And then I'm going to push them into the pockets. And I
Okay.
like to use the new Ivoclar light to hold the teeth down and cure. So
Okay.
it's kind of tack cured before I put it in my cure. And then, of course, I'm going to put it in my cure. So then it cures the teeth and the base
And
together.
you're tack curing like 20 seconds, or like
Yes.
five, like
Yep.
a
Just
quick.
enough to where, because when you push it down, you'll see some excess kind of
Huh?
come out. So I'm going to clean
Right.
that excess off. And then I'm going to go ahead and tack cure it. But I
Cap it.
will say
Okay.
I candy coat too. So before I like fully cure the denture, I'm going to tack cure everything. And then I'm going to put resin over the prosthetic. And then I'm going to cure that candy coat layer and the tooth merging with the base layer in the cure. And then, of course, I'm going to do the glycerin cure.
I gotta ask you, can you over cure these things? Because I feel like I do that all the time. I hit it with my
So,
like light
yeah.
cure, and then I'm like, all right, now back in the oven. I'm like looking at it, I'm like, maybe we go back in the oven one more time, buddy.
Yeah,
Yeah.
yeah, that's a good
Yeah.
question. So studies show that if you cure and cure and cure and cure, it makes the prosthetic brittle. But if you cure, like a lot of times when you candy coat, you have to cure it like basically one time and a half, or
There we go. Yeah. Yeah. Because I feel like sometimes I get it out and I'm like, still a little.
yeah. I
Yeah.
mean, it doesn't shrink anymore. I have that question, like if you keep curing it, does it just keep shrinking, shrinking? I'm like, no, it doesn't. It's still the same, but
So
it
it's
does like if you
so
cured it
tiny now.
10
It's tiny
times, it would be brittle, okay? But the little bit extra that you cure it when you candy coat, it's not going to affect it too much.
Yeah. Okay. Yeah. I'm about a time and a half. That's
Yeah,
about
yeah,
like what I've
perfect.
done, and I was like,
Yeah.
I'm not doing like 4 or 5 times. I'm not like making a denture for ants, you know. So you've done that curing. Now polishing.
Yep.
Yeah. You've painted on the resins and everything. Are you polishing before you layer some more characterization? I'm assuming you're probably doing it at both.
Yeah, so because I'm candy coating the prosthetic, that is actually my polish. So
Gotcha.
I don't polish the prosthetic at all. So I'm candy coating the prosthetic. I'm putting in any colors that I want to into the candy coat, and I'm curing. And then when it's finished, and I grab it from my glycerin and I wash it, it's super shiny, polished. It's of course, the resin. I have technician friends that were for a long time before we really heard of candy coating. For like night guards, they would just take OptiGlaze and just run it over the surface and cure it on the night guards. That's what every lab that I ever
Mhm.
known was doing. But you have to
Yeah.
think the OptiGlaze is external, right? It's going to
Mhm.
wear off and kind of. But candy coating for me has been really predictable because it's the resin, so it's really held up
Right.
really nicely, and I really don't have. I don't see that I'm having patients come back with a lot of staining on the
Yeah,
prosthetic.
I've noticed that with the optic glaze. The optic glaze.
Yeah,
Not
it
only that,
will.
I've had some like I kind of train my assistants to do these components as well. And sometimes when they're getting a little overzealous and put it on the tissue side, I feel like
Yes,
the tissues don't look as happy. I mean, maybe they're creating weird little porosities, or the
correct.
tissue is not happy about
Yeah,
the optic glaze. So like, I like the candy coating technique.
yes,
I've never heard it called that, but I understand it. And what you're
yeah,
talking about is using the resin to kind of glaze it over again.
yeah.
But let's say you adjust the occlusion. What are you polishing with for the apex resin?
Usually just like a polisher. I usually have the Scotch Brite polishers that I'll just lightly brush over these
Nothing
people.
unique. You're like, gotta use this,
No,
gotta use that.
no.
Gotcha. Yeah, we love to hear that. What about the Onyx? Onyx,
It's the
same
same kind
thing.
of thing. Yeah,
Same thing.
yeah.
That's what I mean, it's just a universal. But I've heard people say, hey, no, you should be using this kind of polishing unit versus these other polishing units, and I've never had an issue with that
Yeah, no, I'm
polishing
super
unit.
simple. So any
Yeah.
polishing unit that I have, I'll give it a try.
So that's going to wrap us up for 3D dentures today. You dropped in some good. I mean, can you rehash again those resources that they could go to learn about the workflow a little bit more in detail and watch it over and over again to actually
Yes.
learn
So
it?
YouTube, Dr. Wally Renee, amazing content, free, really good for 3D printed dentures. He's like the master of 3D printed dentures.
I'm
So
writing that
he's
down.
amazing. Yeah, and then Sprint Ray also has some really good informative things on their site. It gives you more information about the resin. If you have that system or you're looking into the system, it gives you a little bit more information about strength and workflows and all that. So it's a good resource as well.
Hey guys, as a friendly reminder, we're doing this out of love and passion for this field. So there is no outside income coming in to support this podcast. We're powered by your likes, your views, your comments, sharing it with friends. I know Cricket's going to be on for many more episodes, and it sounds like it's impossible to steal her. But I'm going to keep trying. $300,000. Thank you guys so much for listening. Until next time, take care.